This topic is phases of a therapeutic relationship. Hildegard Peplau in 1952 wrote a book called Interpersonal Relations in Nursing. This work developed a systematic theoretical framework for psychiatric nursing and defined the therapeutic relationship between the nurse and client. The nurse and client work together. The nurse brings their knowledge, skills, and expertise, and the client wants to have better health. They identify a problem together and then try to find resolution and solutions together through the implementation of the nursing process. Peplau spoke about the nurse-client relationship going between different phases, and sometimes these phases overlap. These phases include pre-orientation, orientation, working, and termination. Let's look at these phases separately. Pre-orientation. This is the preparation assignment before meeting the client. You review information about the client. A lot of times, we can get that information from the medical record. The history and physical, what has happened in the past that may affect today and the future. What is their diagnosis? Do they have multiple diagnoses? Progress notes. How is the client doing with the plan of care so far? Prescriptions. Are some of these new? Do they require education, or does the client have questions or concerns? Laboratory results. Is something else going on with them? A couple of examples could be an infection and their WBCs are elevated. Do they have electrolyte imbalances? Is a medication working or not? Is a medication within its therapeutic level? Anecdotal information from staff. This may be suggestions on how best to interact with your client. What has worked in the past for them? And then we need to explore our own personal values, beliefs, thoughts, and feelings prior to meeting the client the first time. What are we carrying into this relationship? It's normal to sometimes feel excited or scared or anxious. Orientation. This phase can last a few meetings or take a much longer period of time. It includes introductions and establishing trust and rapport. First, let them know who you are and what is the time frame you are going to be there. Hi there, my name's Gina and I'll be working with you over the next 6 weeks. We establish trust and rapport with understanding, consistency, empathy, providing support, and helping the client problem solve. We want to establish a contract for intervention. It'll include expectations and responsibilities. We are working together with the client, not just for the client. They have to be a part of their own plan to get better. What are the client's expectations and the nurse's expectations? And then setting goals we both agree upon. Confidentiality. Can the client trust you with the information they're about to give you? Who are you going to tell? No one outside of their care team. This is an ethical and legal obligation we have to our clients. And termination. We already want to start to talk about this in that orientation phase. The duration of when you will be there and for how long. It could be, I'll be here for 3 hours every Tuesday morning for the next 6 weeks. We want to address this early so that the client knows what to expect. It'll include our plan of action for meeting goals. How will you use your time together? It could be, we will talk about what went well last week and what could use improvement, and then set new goals for this week. We want to identify strengths and limitations. How can the client use those strengths to achieve goals, and strategies for them to expand upon their limitations? The working phase. This is working on those goals that you established with the client. Tasks to promote client change. New healthy coping skills. How can they cope better? We also want to help them manage symptoms. Now, this could be symptoms of their diagnosis or symptoms of medications. Problem solving. You've defined the problem. Now, how can we help the client solve that problem? This may include education and maybe modeling for the client. And then overcoming client resistance. Clients may be resistant to change. Change is difficult for everyone. Or they may have increased anxiety when discussing difficult situations and issues. We want to work through all of this with the client. And we can evaluate progress. Have they achieved the goals we both agreed upon? The goal is for them to be an active participant in their treatment. Have we prepared them to do that? Maybe there are still areas for improvement. Termination. You discuss this in the first meeting and throughout the working phase. It brings closure to the nurse-client relationship. It occurs when a goal has been met or a client is discharged. Feelings about termination can trigger strong emotions for the client and for the nurse. We can feel sad that our time with the client is now done, and we want to let the client know this. It allows them to feel the same. We want to review what we've worked on with the client, summarizing the goals we achieved, and then reviewing education, maybe about a new medication or reviewing how they can recognize that their symptoms are escalating. We can review new coping strategies. It may involve providing the client with resources for times that they need assistance. And then we can exchange memories. This can help validate the time you spent together and make the termination easier for you and the client. And then we want to discuss future plans with the client. What are their plans to continue on their path to health?